Hey guys, welcome back to 2-Minute Doc, where you can master various concepts in medical school in just 2 minutes. In this video, we're going to learn about Duchenne Muscular Dystrophy, which is a very common muscular dystrophy. Duchenne Muscular Dystrophy causes progressive weakness of muscles. It usually affects only boys because it is an X-linked recessive condition. So boys have XY chromosome. When the only X chromosome they have is affected, they will show the disease. Whereas girls have XX chromosome, so when one X chromosome is affected, they still have another X chromosome, so they just become carriers of the disease, but they won't have serious symptoms. Even if they have symptoms, it will be very mild symptoms. To be specific, in the X chromosome, it is XP21.2 mutation, and this leads to absence of a gene called dystrophin gene. This dystrophin gene leads to production of a protein called dystrophin, which helps in anchoring the actin to the membrane glycoprotein. So, since the dystrophin is absent, this process will be affected, leading to progressive degeneration of muscles. And this will lead to fibrosis and fatty infiltration in muscles. These patients often have calf pseudohypertrophy, means the calf muscles will look very big in them, but actually it is not due to hypertrophy of the muscle, but rather it is due to fatty infiltration which is happening in these muscles. It can also affect the heart, leading to cardiomyopathy and arrhythmias, and the respiratory muscles also undergo weakness, leading to respiratory dysfunction. Usually death occurs by around the age of 20 in these patients. Creatine kinase is a parameter which is often elevated in blood from the birth itself, and with increasing age they tend to fall. Echo scan can help to identify the condition of the heart. Electromyography helps to identify the condition of the muscles, and muscle biopsy can help in confirming the diagnosis. It can be identified intrauterine itself by performing the DNA tests by the chorionic villus sampling, which can be obtained intrauterine itself. The treatment is often supportive, however, steroids have a very beneficial role in decreasing the progression of the symptoms, and you need to know about the specific drugs called as oligonucleotide splicing drugs, for example, etoplirsen, which has got a very beneficial role in the management of Duchenne muscular dystrophy. Thank you so much for watching this video till then. If you found this video helpful, please hit the like button, share this video to your friends, and comment below what video you want me to make next. And hit the subscribe button right now so that you won't miss out any of my upcoming videos. Thank you so much for watching. I'll see you guys in my next video.